My daughter's mom had a lot of hair loss after her second pregnancy. She had lost at least a good finger off of the top of her hairline. So it wasn't so much overall female pattern hair loss, whereas like diffuse thinning throughout, it was a little bit of that, but more of her hairline actually just disappeared after the second pregnancy that she had. What can she do to maybe get some of that hair back if she wants to reframe her face?
Well, we want to take our time. Obviously, females, and when they're carrying a child, their body goes through a lot. And then, of course, when they give birth, that body goes through a lot. It basically gives up everything it had. It was holding on to a bunch of extra estrogen, which, ironically, when a female is pregnant, her hair is going to flourish. When they have the baby, everything going away that quickly, just kind of from a hormonal standpoint, it's very challenging for the hair. Dr. McGrath likes to use this phrase, estrogen is your friend. Anytime you're talking about a female body and when you talk about estrogen, that's a good thing for the hair, and you're just basically shedding all this extra estrogen all at once. So that's why you're going to possibly see, and many women see, some hair loss when they do give birth. The way that you can manage that is the same way that we talk about. There's no magic pill. We want to look at, as long as she's not breastfeeding, we want to look at maybe getting her on the oral minoxidil, all right? If she's breastfeeding, no. Then the only thing she can use if she's breastfeeding is the laser. What I would tell anyone that has hair loss after giving birth is to immediately start using your best laser cap. Try to use oral minoxidil as long as you're not breastfeeding. If you're breastfeeding, you need to wait till you stop breastfeeding. But losing your hairline usually ends up going down the path of transplantation after that year if we don't see some results from these preventative treatments.
Because she doesn't have diffuse thinning and it is just the hairline, she should actually be a great candidate for an FUT surgery and should be able to get back her hairline like pretty easily, right?
When you identify possible female patients for restoration, male patterns, I'm just using that as a pattern, not as a gender, that is a good candidate for a transplant. I always use African-American females because they don't really have hair loss. It's been pulled out, and it's usually, of course, right in that hairline. So that's not easy, but it is something that can be done without any risk of us saying, well, why did we do that when she's got all this thinning? So yes, that is the good news. If you have hair loss right in the hairline and a little bit on the temples, then you are a good candidate for surgery as long as you're not seeing any loss, any diffuseness in that donor zone.